patient population in sports and increasing number of accidents that are happening on the roads. If I take accidents, then I think it's usually the two-wheeler accidents which usually cause an ACL rupture because the patient falls on a knee in an awkward fashion, which results in an abnormal force being applied to the knee joint, and that's why patients get injuries. If I talk about sports, it's usually the contact sports like soccer, which is on the increase now, as well as sports like hockey, rugby, and sometimes cricket and badminton, which lead to these ruptures. Clinically, these patients usually present with a swelling in the knee that occurs really quickly, and they are not able to take weight on that leg and have sensation of instability or give way. The clinical diagnosis is usually based on the help of certain special tests like the Lachman test or the pivot shift test or the drawer test, in which we elicit abnormal mobility between the tibia and the femur. An MRI scan that is usually performed will then show us that the ACL is torn and ruptured and requires some form of treatment. About 30% of all patients can be treated non-surgically, and this is especially true if we are dealing with someone who has a low velocity injury or can be termed as an ACL coper. These patients are treated very well with the help of a good brace and a specific ACL rehab program which will allow them to retain their pre-injury function levels. Patients who have gross laxity or have sensation of buckling or give way require surgical treatment. The surgical treatment should be optimized and individualized for each patient. So essentially, it is important that surgery should be done when the knee is silent or quiet, when the knee has a range of at least 80% compared to that of the opposite side, and when the strength in the injured knee is about 80% as compared to the opposite side.